All right, please let me know if you can see my screen.
Yes, I can see your screen.
All right. Good morning again, everyone. It's great to be here. I am excited to be taking us through how field and how shelf life is supercharging the maternal health supply chain in Africa, specifically in Nigeria. Just to give a background, every minute a woman dies from complications in childbirth, and this is as a result of very preventable causes such as postpartum hemorrhage. And the truth is that most of these deaths are not due to the fact that the doctors or the midwives don't know what they are doing. They're not due to the fact that the drugs are, not available. They're just due to the fact that the the medication is not available at the right place at the right time. So, that's the problem. And in Nigeria, we've been able to do our own research. We've done our homework, and we've seen that, over 45% of health facilities in country report stockouts of life-saving uterotonics like oxytocin because of, as a result of broken supply chains. And I'll be unpacking how shelf life is turning the tide and ensuring that no mother, is dying, or no mother dies while waiting for, this essential products that's already available, already existing. I'll be taking us through some common supply chain challenges in maternal health. I'll be taking us through the impact of some of these challenges, impact of stockouts, impacts of quality issues on maternal outcomes. And I'll also be taking us through how through shelf life's approach to building a reliable supply chain system in Nigeria. Okay, so I'll briefly talk about field, because I know from the first slide we saw a field logo, and then we also saw shelf life, just to give a background for in case there are people here that don't know who Field is or what Shelf Life does. So Field is the organization that empowers African healthcare providers in every setting, governments, that's public and private healthcare providers. So we empower these providers with technology, we empower them with fulfillment, that's physical, supply chain logistics, and we also empower them with financing to expand the access to care. So first, Field Supply is a software as a service, is a tool, is a tech tool that um, helps with health supply chain management. We like to describe it as a control tower that connects different actors in the supply chain ecosystem, from governments to private institutions, healthcare providers, pharmacies, patent medicine stores, hospitals, drug revolving funds. So we support these providers through this tool that's specifically designed for the health supply chain. And this tool is used for reporting, it's used for planning, it's used for fulfillment, it's used for analytics as well, to examine, all the data that comes in, and is used by all these healthcare providers, both in the public and the private healthcare space. Then shelf life is the distribution and financing arm um, that provides the same providers with high quality pharmaceutical products through the field supply platform. So shelf life uses pooled procurements, we plan, we fulfill. That's long haul, last mile deliveries to healthcare providers. And we offer different services. We offer vendor managed inventory. We offer financing, that's a revolving line of credit for inventory purchases. We also offer basic or instant deliveries. And then finally, we have like a market access program, which involves, building and introducing new routes to patients for manufacturers and donors. So this is essentially bringing in, there are gaps in some essential medication that are still not available in country. So we leverage our digital and our distribution capabilities to just accelerate the introduction of new products, in Nigeria as well. So this slide is about the problem. What's the problem? In Nigeria, in Africa, women are 45 times more likely to die in childbirth than any other continent. And, you know, the leading cause is postpartum hemorrhage. From the charts, the pie chart, you can see that postpartum hemorrhage is a huge chunk of the pie itself, 27% of um, 20, it makes up to 27% of the cause of death in uh, women that give birth, women that are in the process of giving birth. So we know that, there are some underlying factors such as, many of these women have sometimes have like unknown high or poorly managed risk factors. And in a lot of facilities, there are, there's a lack of diagnostic tools to, adequately diagnose and even know, if they have any underlying or risk factors. And we also have an inadequate supply of quality heterotonic drugs in these facilities. These are even for the women that, give birth in facilities. We also have a lot of women that give birth at home as well. And we would like to say it's a supply chain problem and it's also a market problem. It's a market problem because, I mean, if you look at the challenges that is faced in the Nigeria, both public and private healthcare space, we have weak information systems, a lot of information consumption happens, at the last mile at the facilities, hospitals, primary healthcare facilities, and this information is not being tracked. So there are no records keeping systems available to track. The supply chain is fragmented, it's broken. There are a lot of actors doing different things. There are, all over the place. It's not streamlined. We have infrastructure problems. We don't have, for example, cold chain equipment in these facilities to store cold chain products. The infrastructure itself in Nigeria, for example, the roads are not good, for distribution of drugs, And then we also have resource constraints from that the lack of resources to, finance to get this life-saving medication. A lot of providers would have to ration, what is available to them. And all this presents presents as a supply chain problem. We also have lack of trained, workers. We have so we would say that it's a supply chain problem. There's poor data management, financing, there's no capital. And there's also a market problem because of the fragmentation and the limited investment in supply chain. A lot of new therapies that would come in, they're only maybe interested in making a profit, introducing high markups, but they are not really interested in, contributing or even improving the system, the supply chain system in country. So that's what we call rent-seeking therapies. So also a bit more about the problems. So what leads to a weak supply chain? We have market fragmentation, we have weak data management, and we have inaccessible finance. So, for example, if a provider is struggling to even understand what their consumption is because they're not keeping records, they would struggle to stock the right quantities. So they're either understocking or overstocking. So overstocking will lead to expiries. It will lead to them tying down their cash. Then understocking will lead to stockouts and, missed sales, and, they would not be able to administer these treatments. And then this is just like a ripple effect. So this would lead to like poor health outcomes, there's no growth in the supply chain market, the health supply chain market, you know, quality of care is reduced, and, the providers will struggle to even continue with their business and struggle to grow and even sustain their business. In Nigeria, we have a lot of macroeconomic challenges. We have inflation, we have high cost of medication, we have currency devaluation. All this leads to, you know, a very, difficult market to operate in. And if, if demand is not monitored, you'll not be able to forecast, forecasting will not be able to happen, and it will lead to all these outcomes. And then there will be supply chain gaps because obviously there are no adequate, storage, infrastructure, transportation, and this will just lead to high cost, high prices of commodities, and the providers not even being able to stock them. So narrowing it down to postpartum hemorrhage, uh, these are some of the data that we were able to pull because from the Nigeria's National Health Logistics Management Information System, that the public health facilities use uh, to report their consumption. So 75% of facilities report oxytocin concerns due to cold chain failures. And we have substandard, that's the quality now, substandard oxytocin, leading to either double dosing or wastage and treatment failures. So when there's the fear that this oxytocin was not stored properly, I'm not sure how potent it is. A lot of these providers, these midwives would either double dose, so administer double doses, which would lead to obviously higher cost of treatment to the patients, and it will lead to wastage as well. And then also misoprostol is also very relied on. So you would hear like a midwife say they use misoprostol, not because it's the best option, but because, that's what they can afford, that's what they can have access to. And cost to serve the postpartum product it has increased by over 25% just in the last few years. And the availability is not there. 25% stock out rate of oxytocin in public health facilities, and then rationing as well of oxytocin. And so, MNCNH, the products are not, they're not getting to the right people. The coaching capacity, coaching infrastructure is, non-existent, and there is no existing route to patients system for even new product introductions. And the MNCNH supply chain is very, I would say, weak, and it also leads to a lot of gamble happening at this point of care. So what's field or what's shelf life doing about this? We've been able to find a way to build ourselves into the value chain to improve outcomes through, like I mentioned at the beginning of the presentation, tech solution, digital solution, which is field supply, that helps with tracking of, inventory, helps helps providers to make data-driven decisions, data-driven operations, and on the financing side of things, we extend credits to both private and public agencies through revolving credits revolver. Then for coaching as well, this is one area that we've been able to build our competence in the last 1 year. We've been able to, supply, oxytocin to, over 200 facilities. And this has, strengthened the oxytocin coaching supply chain in country. It's led to, improved health outcomes in these facilities we supply to. And for supply, we've been able to, introduce the PPH bundle, which my colleague will be throwing more light to the products that make up that bundle and what they do. We've been able to introduce into markets. We've been able to introduce even, new products that were not even in country before. That's like the drips and the heat stable Carbetocin. Been able to introduce that and, supply it to facilities, and the feedback has been very great. This has helped. That's gone a long way at these facilities that they've been introduced to. We've been able to use pool procurement, aggregate our demand and pool procurement to get better pricing for these products and these products are, quality products approved by WHO, approved by SRA, and the likes. So this is what field and shelf life is doing for the MNCNH supply chain in Nigeria at the moment. And, these are some of the capabilities, both software, that's digital, and distribution capabilities that shelf life provides. We provide ordering, providers can, place orders at any time. We have, aside the PPH bundle, we have a standard MNCNH bundle that covers a lot of products as well. We have total of over 3,000 products we offer at the moment across over 50 treatment areas. We also offer rewards, we offer cashbacks, we offer free deliveries, at no cost to the provider. We offer financing solutions, either the vendor managed inventory service where providers can only pay for what they sell, or financing, that's the credit revolver. And there's also the record management side of things where providers can, view the history of what they've ordered to reorder. We also have inventory management capabilities. Clients can, see transaction history on their wallet and also monitor their inventory as well. We provide operational support through recommendations, through planning, and our strong suits, which is delivery. We provide, fast delivery nationwide, tracking of shipments, and also an electronic proof of delivery. So these are some of the things, and our networks with retail pharmacies, hospitals, clinics, public facilities, donor programs, drug revolving funds, NGOs, and the like. So these are all the providers we can support. So I'll just conclude by saying that, yes, there's a problem in the in the maternal health supply chain in Nigeria particularly, but field is doing something about it. And it would be a very great idea to have, as many people on board on, this great initiative that field is, bringing out there to improve the health supply chain in Nigeria. So that would be my bit. Thank you.